You're listening to the Safe Tea podcast, hosted by Nikki Brown-John, where we talk all things safeguarding over a cup of tea.
Welcome everybody to this Brent Safe Tea podcast. I'm Nikki Brown-John and I'm the independent chair for Brent Safeguarding Adults Board. And I'd like to introduce today Ruth and Amara, who've come to talk to us about suicide prevention. So just as a warning for anybody who is listening to this, this is a really sensitive subject which might trigger directly or indirectly. So do look after yourselves and don't listen if you feel unable to. So Ruth, would you like to introduce yourself?
Yeah, hello everyone. So my name is Ruth Duplessis and I'm the Interim Director of Public Health here in Brent.
Thank you. And Amara, would you like to introduce yourself?
Yes, hi everyone. I'm Amara Masood. I'm working as a clinical director in mental health services in Brent.
What makes you passionate about suicide prevention?
So for me, it's been over 10 years since I've had a real passion around suicide prevention. It started fairly early in my public health career when I was asked to look at the new suicide prevention strategy that had come out nationally and look at what we needed to do locally. And it wasn't long before I started to speak to local people and hear people's experiences. And I just found it heartbreaking and touching. And also I think what struck me right from the start is how every suicide affects so many people. For me, it feels like every suicide is a failure of society. I just felt it was so important to try and get things right so that we don't have suicide would be my aim. And so ever since then, I've been really passionate, and I've seen that actually by working together, we can prevent suicide. And it's really important that we talk about suicide and we take action on it. So that's why I've been trying to be an advocate really locally, regionally and nationally. And I think it's needed more than ever because sadly our suicide rates in England have been going up for quite a number of years. So it's going the wrong way. So we need to keep the advocacy around suicide prevention.
Thank you, Ruth. And what really struck me from what you said, it's one of those words that we don't use. We don't talk about it, do we? And enough. And so therefore, if we're not talking about it, we're not able to prevent it properly. And then secondly, that it's a societal issue. So this isn't about any particular agency or any person's failure. And what about you, Amara? What makes you passionate about suicide prevention?
I'm a psychiatrist by background. So over the years, I have had experience of working with a very vulnerable individual in society. When it comes to the suicide prevention, to me, at its core, it's all about humanity. It's about recognizing that the people can reach certain moments in their lives when they feel so hopeless and the pain that they feel is quite unbearable. And the only way they see the exit to that pain is to ending it all. And that's something I cannot accept as a human being. So my passion comes from the belief that connection can save lives. When someone is struggling, they often feel that they are mostly unheard and misunderstood, or they don't have anywhere to go to talk to somebody. So if a simple conversation can change lives, then why not? And this is why, I come into this profession to make the difference in people's lives.
Thank you, Amara. And again, I think, I could really sort of sense your passion there. And it is about humanity. And I was just remembering there was a news item where somebody had just stopped and spoken to somebody and they were able to prevent that, and the difference that made for that person. They lived and it transformed their life. I'm chair of the Safeguarding Adults Board. My focus is on safeguarding. So could you talk about suicide prevention links to safeguarding?
I think for me, it's fundamentally the same. For example, it's about early identification of the risk and protecting the vulnerable individuals. We have so many services, and safeguarding can be one of the route to enter or to tap into. For example, mental health services, to the local authority, to primary care, to any voluntary care sectors, just to everybody to come together to address what is making that particular individual so vulnerable that that's the exit plan they're thinking about. And if there is something, for example, they're struggling financially, if there is a housing issue, if there is a mental health disorder, we all as services could intervene early to deliver a different outcome to what the person is perceiving at the time. So I think they're very much linked in as to early identification and stepping in early.
And so for safeguarding adults, we really look at those who have care and support needs and aren't able to manage those without some help. And so that fits in with some of that mental health work, doesn't it? That they need some level of support.
I suppose I'm a helpist and nurse by background, and I do remember early in my career having to make a disclosure to set around safeguarding when I visited a mum who'd had a really bad upbringing herself, and was then saying when she saw her beautiful baby how much she loved this baby and didn't want the baby to suffer the things that she'd been through, and so made a disclosure that she'd been having suicidal thoughts. When I asked her the questions about what kind of thoughts have you had and how far have you gone in your planning, she'd actually thought through about how she might actually take her life. And I had to respond there as a professional to do a safeguarding referral for her and her baby, and also make sure that we got the support that she needed and the empathy and the care. And I'm glad to report that through that process, we were able to get that mum the support that she needed, and we had an amazing outcome that she went on to be a fantastic mum to that baby. So I just wanted to say that it's so important talking about this and asking questions, and that sometimes it's hard to make a safeguarding referral when somebody shares something, but sometimes that's what's needed. And I back up what Mara was saying about our duty, really, to be asking questions, to protecting the most vulnerable, and also to feed back themes. So we're sharing the learning and developing as well. So it's important that we're doing it both practically on the front line, but also strategically.
Yes, you were talking there from a children's safeguarding perspective, and so suicide can link in with safeguarding across the age range, can't it? And so it's not just about those who are with care and support needs, but it might be a parent of a child, or it might be children. And certainly in some of the work outside of Brent that I've done, we can see suicide or suicide intent, and so looking at what's underneath that. How has that young person got to that stage, and then to be able to move on into adulthood safely. One of the newer areas where there's a focus on suicide is around domestic abuse related death reviews. So it's not solely around domestic homicide, but actually for a victim of domestic abuse. And so I think it links in with what both of you were saying earlier around that need to be able to have conversations, that human approach. So what access to services do they have? Yes. So can you tell us a bit more about suicide and who is at risk? What are the signs, the indicators that we could look at?
Talking about domestic abuse, for example. So when I look into the suicide in itself, there's not one cause to it. It's very complex when it comes to any who is at risk and what's contributing to the risk as well. We as professionals, we are very much trained to start conversations about somebody's early childhood or early life or any traumatic experiences. So what really has happened in somebody's life for them to think like that. So one of the elements can be domestic abuse. The other can be the bereavement. People sometimes feel quite left alone and isolated after their loved ones are gone. So certain dates coming up or any anniversaries add to the overall risk for people with some mental health issues. They are quite vulnerable to developing these repetitive intrusive thoughts, especially people who are experiencing depressive illness in their life. And sometimes the physical health issues such as chronic disability can add to that as well. Sudden changes in somebody's jobs, any financial pressures. We know the cost of living crisis going on in UK at the moment and how difficult it is for people to plan to meet their day-to-day needs, especially including around their family. So that sometimes put people in a certain state. The only exit they think is the suicide. Similarly, any previous suicidal attempts or any self-harming behaviors in people's lives. So it can be multiple factors, not just one adding to the risk of somebody feeling the way they're feeling. Also, the overall feeling of feeling hopeless or trapped in an inability to shift some of the circumstances around them. And similarly, all these factors that I've said, if they have stable families around them, if they have stable relationships, connections with the community, they feel part of the community, they can be protective at the same time.
I totally agree with really. It's complex. We live in a complex world. I think it's more common than people want to talk about as well. And I want to emphasize that really, because the survey data that tells us that around a quarter of us potentially at some point in our life have thought of suicide. So those thoughts are there, and circumstances can go wrong for any of us. Bereavement, a relationship breakdown, a sudden financial situation, somebody letting you down, you feeling you've let other people down. And along with that, when people feel like that they're a failure, people have those kind of thoughts of the world is better without me, I'm just no good. And I think also we talked about actually when people feel humiliated, and I think this is something we really need to think through about services. And somehow sometimes we do things that build on people's feeling of a failure. So that's something to be mindful of. It's important to say that it's not about wanting to die. That's what the evidence says, is that actually it's people trying to escape unbearable pain. We're seeing it more about people who struggle to communicate. So people perhaps with a learning need, or attention deficit disorder, other things like that. When people struggle to get across or feel like they're not understood, that's also a risk factor. But we know that some of these feelings are temporary and things can change and we can rebuild. And I think this is so important that we're identifying how people are feeling and responding to circumstances, because the people I have spoken to who've had a suicide attempt and then come through that, and they talk about how at the time they couldn't see a way out, but now they're so glad that they're still here and they've been able to turn things around. And I've heard many such stories.
Thank you both. And I think that it is important for services to really recognise how we respond might make a difference to a person. Both of you have started to talk about some of the signs, but what are the most common myths when it comes to suicide?
I think the one that I think is most common is that people are afraid to mention suicide. So they've got a friend or a colleague or a family member that they're worried about, and they're afraid to say to the person, are you having suicidal thoughts? What kind of thoughts are you having? How bad has it got for you? Because there's some sort of fear that if we talk about suicide, that could be a trigger for somebody. But actually, the evidence says that people feel unable to say that they're feeling suicidal because unfortunately in society we've got a stigma, and somebody asking the question is just giving people permission to speak can lift a burden already that people feel that somebody cares enough to listen. So that would be my big message, is actually have the courage to speak to people. And if you're worried about somebody, ask them, have you had suicidal thoughts? How is it for you? So that would be the biggest myth.
And I had that experience with a friend who was bereaved, and they'd been going along and seemingly okay. And then a group of us who knew them really well suddenly recognised one day that there was a change in their behaviour, and saying to them, "Are you okay? You've changed. What is it?" Just almost woke them up, so that actually that they went off and then sought the help and got back up to where they needed to be. Anything more, Amara?
Some of the beliefs that I've come across with people is that, you must have a mental illness to be feeling suicidal. And sometimes that's not the case. People can not have a mental illness, but they might have some financial difficulties, or they might have the housing difficulties, or something in their life has changed, or it might be as a consequence of simple bereavement that they're going through the loss and come to terms with the loss. So it's identifying early what really is contributing. And not that the suicide or feeling suicidal is part of mental illness, can be a manifestation of something that they're going through, which is very different to a mental disorder. Picking up and not hesitating from those conversations where you find somebody might be struggling and their thinking process might be changing, just asking them about how are you? How are you feeling today? And start those conversations. Similarly, what I've come across over the years, people who actually are experiencing suicidal thoughts, they probably don't want to die. It's just an expression of their helplessness with the situation or feeling of being trapped. So if you guide them, if you signpost them to whatever is bothering them, to making them feel to this extent, and if we can help to resolve the triggering factor and deliver a different outcomes, these thoughts can be shifted. And I've seen very successful stories where somebody was feeling completely hopeless because of their housing situation and making a conversation with the local authority to back their evidence of their needs. And a different sort of accommodation was sorted out where they felt more supported, delivered completely different outcomes. So it's just picking up those conversations, identifying those triggers certainly helps.
I was going to say, I think that I'd add to that as well, that there's a myth that it's an easy way out or that people are attention seeking or selfish. And I want to say that that's not true. Many of the people I've spoken to have been carrying a burden for a long time and they've got to a point of desperation. And sadly, every year in Brent, we're losing about 20 people a year to suicide. And so I just wanted to say it's not selfish, it's not attention seeking, that's a myth. This is real and we need to talk about it. I think the other thing is that some people deliberately hide how they feel. Sometimes people have said that they didn't want their relatives to feel bad or to suffer, so they kept it secret. Sometimes there are people who will deliberately hide from their relatives or their family members how bad it is, and it can become a shock, when people have a suicidal attempt or take their life. It always is, but particularly there are some that we do know that will get to a point where they will hide it and just try and pretend as if everything's normal.
How can professionals feel more confident talking about suicide?
To me, confidence comes through the knowledge, through training and having compassionate communication with people. It's about the art of language. Yes, it is a difficult topic, but it is definitely worth talking about because it saves life. So it's about what sort of language you are using. So, for example, if somebody's lost somebody in their life as a result of death by suicide, I've seen people use the word like committed suicide. Committing, it means like you are actually alleging somebody. So I think it's how you're approaching that matter. And there's so many trainings available. For example, there is a Zero Suicide Alliance training, which is accessible. So I'll encourage all the professionals just to learn how to approach this topic and how to use the language to be more compassionate towards when having these conversations. Also, staying safe from suicide e-learning. That's an it's about developing skills, developing some empathetic listening, asking very direct but sensitive questions, and understanding the risk factors and working with the wider agency to come together to problem solve, to change the outcome for the person.
Thank you. And yes, and absolutely. I see it so often that people are talking about someone committing suicide, that, they've taken their own life. It's not illegal, but it's tragic. And so not making them into some sort of perpetrator. Thank you. Ruth.
Yeah, building on that, I think when we've spoken to relatives and to people who've survived a suicide attempt, some of the words we've been using is a non-fatal attempt for people who've survived. And also we've moved away from completed as well. That doesn't feel right language. And so we talk about a fatal attempt or died by suicide. So that's just some of the kind of the language. I think my big message is just showing that you care is massive, and having that pause and just to ask, be brave to ask the question, come right out with it, and feel brave to say, have you had suicidal thoughts? We can talk about suicide. We absolutely can. And so I think just having that courage, and then knowing what to do when somebody discloses to you, as you said, that training is so helpful. There's a fantastic app as well. The Stay Alive app is a fantastic one to download onto your phone if you are worried about some of the fantastic resources on there. And there's several websites as well. And then there's also something called safety planning, which is helping people think through their strategies to deal with situations they might be feeling as well.
Thank you. Thank you. And also then about being able to signpost someone or give that advice to somebody about where to go if they are feeling suicidal. What can we do about that?
So there's a few different places, and again, different people feel comfortable, don't they, with different things. I think the easiest one is probably NHS 111, option 2. NHS 111, option 2, and that puts you through to a 24/7 crisis line. So there's somewhere that you can go at all times of the day or night, and anyone can ring that number and get help and support.
Yeah, definitely. I think when we're talking locally about Brent and in most of the services across England, there are walk-in centres. For example, in Brent, we have Coves walk-in service you could go to. And regionally, now there is a whole shift to move away from the A&Es. You could Google it and where is the nearest mental health centre where you can walk in and they're 24/7. You can speak with somebody, but also online. In addition to this NHS 111, there is another service called Samaritans. I'll encourage everyone, if they are feeling suicidal, to talk to somebody, their near ones, loved ones. If you don't have anyone, you can also make an appointment with your GP, who can make further referral to the mental health services or the crisis services based on the crisis you're in. Similarly, in each area in England, there is a huge voluntary care sector available. If you have identified as a professional that there is a safeguarding need to support somebody to prevent this outcome, then raising a safeguarding alert at that point will save somebody's life. So it's about thinking what facilities are available, which we can engage to prevent somebody from ending their life.
Thank you. Thank you so much. That was really, really helpful. And I think just to sort of sum up there, I think it's about not being afraid to talk about it, either as a professional talking to somebody, or if you're feeling suicidal. It's around training. Do access some of the training that's out there. Then for those who are feeling suicidal, is that there is somebody available 24 hours a day, particularly to sort of Samaritans, and there will be other sources of support locally wherever you are. So thank you so much, both of you. Is there anything last minute that you would like to say?
I would just say every life is very precious. So take care of yourselves and take care of your loved ones, because the loss just does not end with one life or one death. I think it has a ripple on effect on a number of generations, probably other people around you. So take good care of yourself, and where you think we can make a difference, please just let us know, and we will try our best to support as much as we can.
Thank you. Ruth?
I think mine is just, I'm really pleased that we're talking about this and raising the profile about talking about suicide. And I really believe that if we can get things right, that we can prevent suicide. And we need to get it right in terms of making sure that people aren't ending up in difficult situations, and that we're getting the support that people know what support's available to them around the housing and their debt advice and relationship breakdown and all of those kind of things. But also that we're really taking the time to listen and hear what people are saying and responding.
Thank you. So thank you so much, everybody, for listening to this safety podcast about suicide prevention. And again, do take care of yourselves, because it is a difficult subject to talk about, but it's a subject that we must talk about. And it is about looking after ourselves, but looking after each other. And as professionals, for us to be listening to those that we're working with, being available, being flexible, because it's can be a very difficult world for us to live in. So thank you so much.